Ethylene glycol poisoning is caused by the consumption of antifreeze, a chemical commonly found in cars to prevent water from freezing and to prevent coolant from overheating the engine. Ethylene glycol poisoning clinically manifests as intoxication and can be treated by either intravenous ethanol or fomepizole. So what are you waiting for? Let's get started. Our scene is anchored around this antifreeze in the car. By the looks of it, I'm at a really cool fair and had to use my car to get here. But before I get to enjoy my time here, I need to use some antifreeze to get my car to normal again. You see, antifreeze is commonly used to prevent water from freezing, which typically causes cars to break down while they're on the road. And what's the main ingredient of antifreeze? Yep, you guessed it, ethylene glycol. Just remember this image of antifreeze in the back of our car to recall ethylene glycol. Makes sense, right? Now take a look at what I'm holding in my left hand. It's a snow cone. This snow cone is to help you remember a clinically significant characteristic of ethylene glycol, which is the fact that it tastes really sweet. And what do you know? It looks like I accidentally confused some bright blue antifreeze with my snow cone syrup and poured antifreeze on my snow cone. That doesn't sound particularly appetizing, but we'll find out later as to why I accidentally poured antifreeze on my snow cone. That's right. This snow cone is here to help you remember that ethylene glycol is sweet tasting. Because of its sweet flavor, children are at risk of accidentally ingesting it. So just as a precautionary measure, make sure that you keep antifreeze out of young infants and children's hands. Typically, ethylene glycol poisoning occurs in the context of a child accidentally ingesting it or as a suicide attempt by an older adult. Sounds pretty morbid, but as a healthcare professional, it's really important for you to recognize these types of scenarios. Next, notice this big ravine over here. One of the fair's main attractions is located in it. We'll get back to this attraction later on in this video, but for now, let's focus on the ravine, or gap as we like to call it. Where have we seen this before? Yep, that's right, in our video on methanol poisoning. Remember how our old bootlegger was stuck in the middle of a great big ravine? This ravine, or gap, is our recurring symbol for an anion gap metabolic acidosis, which is caused by ethylene glycol poisoning. Get it? Gap for anion gap? Ethylene glycol is metabolized to oxalic acid and glycolic acid in the body. Such metabolites overaccumulate in the body, which can then result in an anion gap metabolic acidosis. Let's take a step back to talk about what an anion gap actually is and why it happens. You see, when blood tests detect acidosis, determining whether an anion gap is present can help you make a diagnosis. Electrolytes in the body are positively charged cations or negatively charged anions. Commonly measured cations include sodium and potassium, and commonly measured anions are chloride and bicarbonate. For electrochemical balance, the number of anions roughly equals the number of cations. But when measuring anions and cations, the number of anions appears to be less than the number of cations. In other words, there is an anion gap. This is not because we're out of electrochemical balance, but rather because not all serum ions are routinely measured. In ethylene glycol poisoning, the gap is larger than normal, however, which results in what is called an anion gap metabolic acidosis. The gap is increased because there are now more anions, such as glycolate and oxalate, which are metabolites of ethylene glycol. Just picture a gap here to peg these facts. So how else do ethylene glycol poisoning patients present to the emergency room? Well, to answer that question, take a look at this ox here. He's part of our Ride the Ox attraction. The ox is here to help you remember that calcium oxalate crystals can be found in the urine of a patient presenting with ethylene glycol poisoning. Get it? Ox for calcium oxalate? These calcium oxalate crystals can coalesce into kidney stones, which is a common complication of ethylene glycol poisoning. The classic picture is a patient with sudden oliguria or lack of urine, hematuria or blood in the urine, and sudden onset writhing back pain. Sounds pretty painful. Next, notice this envelope being held by our main attraction guy over here. He's carrying this envelope to hold all of the money he's making from his ox attraction. This envelope should help you remember that calcium oxalate crystals may be envelope-shaped under the microscope. Pretty interesting, right? Notice also that our main attraction guy is really buff. When he's not lifting little children onto the ox, he's lifting weights like these dumbbells over here. These dumbbells should help you remember that calcium oxalate crystals can also appear dumbbell-shaped on microscopy. Who would have guessed that calcium oxalate crystals can appear as either envelope or dumbbell-shaped? So now that we've gone through diagnosis of ethylene glycol poisoning, let's briefly discuss treatment options. Take a look at that beer I'm holding in my right hand. Remember I had accidentally confused antifreeze for snow cone syrup? Well, it happened after I got intoxicated from drinking all this beer. Anyway, this beer, or ethanol, is here to help you remember that ethylene glycol poisoning can be treated with intravenous ethanol. Ethanol actually functions as a competitive inhibitor of alcohol dehydrogenase, something we'll touch upon very shortly. Finally, take a look at how foamy our beer is. That's a lot of foam. If you've looked at other videos on methanol poisoning, you'll know that this foam is our recurring symbol for fomepizole. Get it? Foam for fomepizole? Fomepizole is our main treatment for ethylene glycol poisoning. Recall from biochemistry that fomepizole competitively inhibits alcohol dehydrogenase, which normally metabolizes ethylene glycol. And if ethylene glycol's metabolites are what makes it so toxic, we should just block their formation to treat it, right? Well, that's exactly what fomepizole, and ethanol for that matter, do. Anyway, just remember that fomepizole treats ethylene glycol poisoning and you should be good to go. Boy, do I feel dizzy from eating this antifreeze snow cone. Probably shouldn't have done that. Anyway, let's do a quick review. Ethylene glycol poisoning is caused by ingesting antifreeze. It's accidentally ingested by young children because of its sweet taste. It is also a common resource for adults who want to commit suicide. Typically, ethylene glycol poisoning can cause intoxication. It can also cause an anion gap metabolic acidosis because ethylene glycol is metabolized to oxalic acid and glycolic acid. In a patient presenting with ethylene glycol poisoning, oxalic acid can be found in the urine as calcium oxalate crystals, which can appear either envelope or dumbbell-shaped on microscopy. Calcium oxalate crystals can cause oliguria, hematuria, and sudden onset writhing back pain. Treatment for ethylene glycol poisoning are mainly fomepizole, but you can also use intravenous ethanol as an alternative. Well, that wraps up this video on ethylene glycol poisoning. I'd better go see a doctor after eating this snow cone. Until next time.